why is malnutrition such an important topic?
Yeah, Tommy, a little known fact is that about 30 to 50% of all patients admitted into the hospital actually have some form of malnutrition.
Wow.
Yeah, it starts when they're in the community, they're already not feeling well, or they have a certain lifestyle that makes them at risk for malnutrition. And then by the time they're admitted, they generally have malnutrition already. So it's a big concern for us in the healthcare setting.
30 to 50%.
Absolutely.
I would have never guessed that number would have been that high. That's amazing. Wow. It sounds like there's a lot of opportunities there, Maureen, for as far as when you talk about for patients and administrators and just in trying to tackle malnutrition and handle it in the workplace. Talk to me a little bit about that.
Sure. So there's two new initiatives that we've really been working on when it comes to malnutrition. One of them is the Global Malnutrition Composite Score. So CMS, the Centers for Medicaid and Medicare Services, just recently, for the first time ever, chose a nutrition-related quality metric. So every hospital has to select 3 voluntary quality metrics, and nutrition now is one of them as the Global Malnutrition Composite Score. The value of this is it's really showing us that CMS is saying malnutrition is important. We need to identify these patients so that we can start treating them. So that's a really nice benefit that we have to help encourage at the hospital that we need to move forward with identifying malnutrition, because now CMS is saying the same thing.
Yeah. And when you're in the hospital and a patient comes in, you can tell they're malnutrition. What's the protocol? What's the steps to kind of help that? Is it obviously you can't take care of it while they're at the hospital. You can get them on the right path, but it's a long process, right? To get over malnutrition. Is that fair?
It is. So sometimes, as soon as somebody's identified at risk for malnutrition, then the dietitian steps in. So they do a nutrition assessment and then they start the care plan. So one of the big things that we work on is making sure we're identifying the right patients, because if the screening process isn't working right, then our dietitians are seeing the wrong patients. So we need to start from the screening process, make sure we're using a validated screening tool, so that the dietitians are seeing the right patients, and then they can start them on the interventions. The second piece that I mentioned earlier, though, is the post-discharge. So the post-care. So it's really difficult to cure malnutrition during a short hospital stay. So we have a new discharge planning toolkit coming out, educating our dietitians. You have to look beyond the hospital. So we have to make sure that our plan of care then says, all right, after they leave, what else can we do to help them?
Yeah, and that's a big
thing, like
right?
I said, they're already coming in malnourished. So we're sending them back after, 4 or 5 days in the hospital. They're going right back to that setting where they became malnourished in the first place. So we really have to work collaboratively with our medical support team to say, okay, what are we doing different for this patient when they go home? And so our discharge planning is a very instrumental part of that.
And it's really just about educating the people too, because they probably don't even know that they're malnutrition. Malnutrition rates. It's probably just so much of it is just educating them on the right foods to eat, the right amount of food to eat, and all that. Is that correct to say?
I'd say yes, but it's also their environment, right? Do they have access to food? Do they have access to transportation? It's their family members, who oftentimes, want to feed them or are in charge of feeding them. Mm-hmm. So what does that family have to support the patient who's now going home and perhaps doesn't have access to food or not healthy food? And so they end up back in a hospital. So there's a strong correlation between what they're doing at home to how often do they come back to that hospital, and we're picking them back up for malnutrition.
Yeah. And it sounds to me like, too, because if we can get them through that process, that we're talking about better outcomes and cost reductions. Is that fair to say? And how does that really apply to what we do in our setting?
Yeah. I'll let Maureen answer that one.
Sure.
Okay, sure. So the better patient outcomes starts with identifying the patient sooner. As soon as we can identify them, the dietitian sees them, then they start the interventions. So malnourished patients are so much more likely to fall in the hospital, to get infections when they're hospital. So the sooner we can intervene, the less likely they are to have some of those complications.
Okay.
So we're looking to reduce their length of stay, and then also to decrease their readmissions, which obviously impacts the patient's outcomes in the best way. And it has a really nice side effect for cost avoidance from the hospital end, because then they don't have to spend as much money on the length of stay and they have fewer readmissions.
Right. Yeah. I mean, that's a win-win for everybody. The patient's healthier, everybody. Yeah. Good stuff. Do you have any clients taking advantage of these opportunities, or where are we talking about from a client standpoint? I mean, I know that's so important as well, is just getting that word out to the clients like, hey, this is what we need to do to help you guys save money and to really make your patients healthier and not come back. So where are we on the client front?
So we have a pretty growing group of clients that are participating in our malnutrition program, because it's not just the intervention, but it's also the documentation, and Maureen will share a little bit more about that. It's really tracking, what we're doing for those patients and what their outcomes are. So our clients are loving it because they're having cost avoidance, they're having increased Medicare reimbursement, and they have positive patient outcomes that are measurable and also have a metric of a dollar sign assigned to it.
Right.
So it's a win-win. Our dietitians are already doing what they need to be doing. Our physicians are doing what they need to be doing. It's just this little extra attention and making sure that whoever we have to see is being seen, that the interventions are being done, and then we're tracking all these outcomes. So our clients are really, once they're on board, I think it takes a while for them to fully grasp it, but once they're on board, they're really loving it. And that list is really growing every day.
Yeah, it sounds like it's just a win-win across the board, like you said. And so, Maureen, my question for you would be like, what can the hospitals do to better combat malnutrition going forward?
Well, one of the first things that we want them to do is to sign up with the Global Malnutrition Composite Score as to be one of their voluntary metrics.
Okay.
Another thing that they can do is work with their clinical dietitians and work with us, because in 2019 we released a software and a malnutrition program called My Malnutrition Tools, and by using this, that really helps us make sure that we are identifying the right patients, that the dietitians are seeing the right patients. So we're really finding that as we're using our program, the number of patients they're identifying and treating is really increasing. So that's another thing that they can look at, is talking to their clinical manager and to us about using our malnutrition program.
Yeah. We did this, we talked about in the first podcast earlier today too, and it really comes down to, yes, there's cost savings for the hospital. Yes, there's, educating and helping the patient, but it really all just comes down to making sure that the patient's healthy when they're in the hospital and then when they go home. And it's just so refreshing to hear, like, in the world that we live in, everybody's in healthcare, but ultimately our core focus that comes from healthcare is the patient, because it all just keeps coming back. No matter where we go, cost savings or whatever, it all comes back to the patient.
Yeah.
I mean, especially with what we're talking about with malnutrition, because when you gave the stat, 30 to 50% of those people that are coming to the hospitals are malnutrition. That's a lot.
They're more likely to stay longer. They're more likely to have complications. So, finding them early on and really finding, best ways to treat them and measuring them and making sure that carries into the community, that's really what our partnership brings to the table, I'd say.
Absolutely.
So we do 3 square meals a day. We do a fantastic job, but this partnership, this expansion of, we're all seeing the same patients, we're all, interacting with them, and our nutrition team really has a unique opportunity here to showcase the value that we bring beyond the food service contract. This is part of the package. And so, to partner with us in finding and treating malnutrition is really elemental here. And I feel like it brings a lot of value to the table.
Yeah, there's no question about it. Yeah. Ladies, thank you so much for your time today. I appreciate it. I've learned something new, as I always do when I talk and have these podcasts, but especially about malnutrition. And I love the fact that we are really pushing that agenda, saying, hey, we got to attack this 30 to 50%, and we can help. You guys can save money, and ultimately the patients will be better off.
Absolutely.
And that's a great thing. Thank you so much, Peggy. Thank you, Maureen, for joining us today on the podcast.
All right.
Thank you.
Thank you.